Well, welcome everyone to another episode of Parenting in the Far North. I'm your host, Aaron Bureau, and today's guest is Dr. Ashley Doss. She's a clinically licensed psychologist, a nationally certified school psychologist. Dr. Doss has worked for the Anchorage School District since 2019, initially as a school psychologist at both elementary and high school levels, and most recently as the district's critical response and wellness coordinator. Dr. Doss also serves as the primary contact and lead for Stop It, which is the ASD's anonymous reporting system, where students, staff, and families can report concerns safely and also anonymously. So please welcome to our podcast, Dr. Doss. Thank you so much for being here.
Yeah, thank you for having me.
Well, first, before we kind of get into all of my questions that I want to chat with you about, just first give us a little bit more about yourself. Who is Dr. Ashley Doss?
Yeah, I mean, aside from all the fun professional things, I am the wife of a military veteran. My husband was a Marine for a little over 10 years, and we have one son, and he is almost in the teenager stage.
Wow. How fun is it?
So close. It's fun.
Yeah.
And then we have a lot of dogs and cats, so we're very animal friendly.
I love that.
Yeah, so we try to do a lot with them and go out, and we love being out on the water and just getting outside because, I mean, I don't know anyone in Alaska who's not like, yeah, that's what I want to do is go outside.
Right? You have to. And I mean, we kind of had this little stretch of sunshine.
Yes.
Even though it's been a little bit more chilly, I'm with it. I just need the snow to just hold off a little bit more.
Oh, I told that to a parent today. I was like, I am just living in denial for the snow, even though I keep hearing all the areas that are getting it.
Yeah,
so
it's on its way.
It's almost here.
Well, thank you for being here. First, I want to start and just say, tell us a little bit more about your role as the Critical Response and Wellness Coordinator for ASD. What is that? What do you do?
So it has a variety of different components too. So aside from the obvious of critical response, so I am supporting a majority of our crisis response across our district as they occur. Sometimes they are really small and they impact one or two students or one or two families, and then other times it's large to where it's either impacting one school or multiple schools. And I adjust my support just based on the need of that school and those students. And that really consists of me leading our crisis response team members, which are comprised of our school counselors and our school psychologists and our integrated mental health clinicians who volunteer to be on this crisis response team, and they get called for whatever their need is, and I help with that coordinating and organization and setup. But I also help our administrators and schools really guide through that process of what recovery looks like after a critical incident. And then in addition to that, I also support our behavioral threat assessments, our suicide risk assessments, and our non-suicidal self-injury assessments, aside from just the paperwork of that, but being the advisor and the support person that our professionals call when we have more challenging circumstances or situations. And then there is a wellness component to all of this because, one, that's in my name, but two, our senior director for mental health and student supports, Dr. Jenny Knudsen, she does a really good job at ensuring and kind of voicing that on every level, wellness is a piece of all of it. And I know wellness has become such a hot topic word, but I really think of it in that sense of like prevention and support after the fact. So what sort of preventative efforts are you taking with support? And then what sort of supports do you need after something does occur that could be potentially traumatic or just stressful sometimes. Yeah. And so really like looking at that, I focus on the types of resources that are needed, information, gathering documents, and we have a work group actually that's working on what that looks like for specific topics too. So,
well, unfortunately, we are in the age where we have things that happen at school shootings. It's in the news. It's devastating and it's scary, in cases where children maybe witness or hear about a school shooting or a death. How can parents and educators work together to provide emotional support? What does that look like for students after they've kind of witnessed or heard of some kind of traumatic event and still have to keep and continue and go to school?
Yeah, and There are a couple of different things that we can do, but I first want to highlight that school shootings are very rare. They're lower chance circumstances. We are more likely to have other critical incidences that do occur. And on any level, they require some level of recovery. So what does support look like? And most of the time, our first step is always to get social connections together so that peers can reunite with each other and share and bond and support one another through, because they're going to understand each other better than the adults will, even though we've been teenagers and young children as well. But at the same time, we're not going exactly through what they're going through in that moment. And then as adults, both on the staff side and the parent side, just being able to support and validate our kids' emotions, listen to what they have to say, and really identifying what are those signs and symptoms of like a bigger need that might require more professional help, because not everyone who's going through a stressful circumstance or experiencing a traumatic situation will need a professional. However, we want to make sure that we're addressing what we call it at ASD Tier 1 supports, that whole level, and making sure that people are getting what they need before we say, oh, immediately refer for additional support. Sometimes they don't need that.
Yeah, and I imagine speaking to the little ones versus, middle schoolers and high schoolers, it's a very different, it's different. So how do you address dealing with the different ages when something like that occurs?
Yeah, so developmental level is always going to be important. It really matters about making sure we're choosing our words appropriately. So you would definitely utilize less words and more opportunities for activities, and like art is such a huge piece in some things, drawing, writing letters, things like that, for our younger kiddos. And then maybe explaining things a little bit more and asking, I find too, especially as they get into that middle high school level, asking them what their thoughts and opinions are and how they're feeling in a lot more of a proactive way, especially when it comes to problem solving. So identifying like, well, how would you approach this? What would you do? Because sometimes those insights from our kids are just so powerful, and we're empowering them to utilize their own problem solving when they do encounter something difficult.
Do you feel honesty is the best policy where, there's TVs or social media, a lot of times they can get access and find out what happens. So when they ask, do you just tell them and be honest, the truth, like, hey, this is really scary, this happened, and just kind of keep it real with them? Or do you shelter it, or do you pick and choose, mainly not so much for you, but for families and parents that are trying to address some of these situations, with their kids?
I get asked that a lot, actually, and I would temper it with yes and no, which can be such a frustrating answer. So yes, honesty is the best policy. However, sometimes we have to also acknowledge, is this information that is going to be helpful or hinder the situation?
Okay.
Especially when we're sharing like sad or depressing information. Sometimes we don't want to share all of it at once. And even if our goal is to be fully honest and transparent about a situation, we may leave out certain information pieces because it's not helpful to the situation.
Makes
or
sense.
in that moment, the child can't handle it.
Yeah.
So if the emotional reaction is very big, then we don't want to keep continuing saying, well, I have to get this information out. It's like, well, they're not ready to hear it.
Yeah.
And I think that's the biggest piece is your child ready to hear whatever it is before, or do we need to look at validating and supporting that emotional response before we can start talking about next steps moving forward?
And how can parents identify signs of trauma or stress in their children following a critical incident?
So when we have to acknowledge there is some level of response that initially occurs. So more than anything, you really want to look at, are these lasting or lingering symptoms? But things like regression in previously achieved milestones for our younger ones. So if a child was recently potty trained, or they learned how to walk, and then a traumatic situation happened, and then suddenly they're not able to do that.
Okay.
That might be one sign. As they get a little bit get older, there are things like they might shut down and not share as much information. They may experience more nightmares. Oftentimes there's a greater level of what you could almost describe as clinginess. So they want to be around you more often. They want more physical affection at times, or the opposite, where they want less physical affection. But really looking at those sort of abnormal behavior that is outside of, and when I say abnormal, I mean abnormal for your child kind of thing. So if it's outside of what they would normally exhibit, that's definitely one big sign.
Kind of like when you know your body, you know your body, you know if something's off or you're not feeling right. I guess the same kind of intuition would go as a parent to a child.
Right.
You kind of know.
Yeah. And I definitely think like sleep disturbances is a huge one. And then like emotional reactivity to a lot of things, especially if there's more crying and more tears, or just a greater amount of withdrawal, especially at the adolescent level, like social and familial withdrawal, due to a significant situation for them, that's definitely a sign as well.
Well, how do you recommend parents balance that by giving their children the space to process it while also wanting to actively be supportive as well?
I think one of the biggest pieces is validating emotions, and not validation in the sense of like, I understand what you're feeling and I feel the same way or anything like that. More in the sense of saying, I do understand how you're feeling and I want to acknowledge that. And, you can, sometimes it helps for kids if they hear an apology, if they feel like you've wronged them on some level, or it's just a big situation. We're not sure what to say. Sometimes we naturally apologize. And that might be what they need, but really acknowledging like, hey, I do see that you feel very frustrated about this, or you feel really sad about this situation. And I can only imagine the depth or the sorrow that you are feeling. And I am just here to support you in some way or some capacity, and really focusing on like, you're there to listen and you're there to hear. And if they want advice, that you will then ask if they want for that, because if they do, they might say, yes, I want you to give me advice. What do I do in this situation? How do I move forward from this? Or they might say, no, all I need from you is just to listen, because most of the time our kids just need a parent to hear us.
Yeah.
Right. And I think too, with that, it goes into, we don't want to negate how they're feeling, even if their feelings seem different than how you might respond.
Right. That's key. So acknowledge and validate.
Yes.
What resources or interventions would you suggest for families who might need long-term support in terms of dealing with the aftermath of a traumatic event?
Some of our best resources are going to be within our schools. Our counselors and our school psychs are very well aware of our community resources that are available, but also the types of supports that can be provided within the school environment, especially at the school level. If we have a traumatic situation that is within school, we really try to make sure that we're following up on either individual students or groups of students. But also we have partnered with a number of our community resources and referrals. So we have integrated mental health clinicians within some of our schools, and they've been willing to work with us so that if they need to and can, then there is a conversation of how we can get them in other schools as well. And that is a growing conversation. It definitely has its limitations, so I want to acknowledge that. But I see more and more just a community response of coming together to support our kids. And especially this last year, I put together, with the help of another school psychologist, a full referral list that is across our state.
Oh, that's amazing.
It is very comprehensive, and I think it's helped a lot of our people in just getting referrals to families. So I definitely encourage parents to reach out to their school counselors and their school psychs, because they have that list and they can help.
I was going to say, how would they go about that? So your local school counselors. Okay.
Yeah, who's ever locally either a school counselor that's assigned, and if your school doesn't have a school counselor, then they should have a school psychologist who has some point of contact with that school. And then worst case scenario, have the principal reach out to me and I will get them that list.
Awesome.
So,
well, we know kids and students, as parents, we want to make sure that they're okay, but when these traumatic events happens, I'm sure, and you deal with parents, it affects the parents as well. We feel like, are we doing the right thing? Are we saying the right thing? So how can parents kind of manage their own emotional responses to a crisis so that they can, be the best support for their kids?
Yeah. I think, one, it's important that we demonstrate appropriate coping skills beyond anything because our kids look to us to regulate themselves. And if we're engaging in an appropriate regulation of ourselves, then they're going to see that and see that being demonstrated and they'll follow suit. So are we taking a deep breath? Are we engaging in progressive muscle relaxation if we need to? Are we taking a minute to ourselves? Because sometimes we just need to step out of the conversation and collect our thoughts and then step back in. So being able to recognize emotionally where we are personally and demonstrate that to our kiddos. And I'm pretty honest as a parent with my own child. I will say, like, I am feeling very heated in this moment or I'm really upset. I just need a minute to calm down. And I think that not only displays a level of vulnerability to our children of like, hey, it's okay to have emotion, but it also shows and demonstrates this appropriate coping skill of voicing your need and voicing how you're feeling so that you can get that met in your external environment. And I think that those pieces will help parents with really navigating how to support their kids so that then when their kid says, oh, I'm feeling this way, then we can not only say, okay, let's take a deep breath or let's do progressive muscle relaxation or a different coping skill that might work, that we've demonstrated it already. So we've created a pathway in the brain for them because, oh, I just saw mom do it or dad do it. So now I know what to do. Gotcha. And that makes it a lot easier.
What would you say to, you deal with a lot of students and families and just nowadays the, with bullying, whether that's online or in school, how do you address with students witnessing something and maybe being afraid to like speak up because it's not the quote unquote cool thing? I know that they can report anonymously.
Yeah.
What are your thoughts and takes on that? Because it's, it's not easy being a teenager.
It's not.
And it's not just the teenager, middle school, like each level I'm sure has its own. It's very different from when I was in high school. We didn't have the social media. So I can only imagine now what it is. So, and I know that's a topic that's out there, your thoughts on that.
I know. I sometimes think it's a blessing that we didn't have social media when we were in school. Not sometimes, often. I definitely would encourage stop it. Anonymous reporting systems in general really help us when we're feeling anxious because that is an outlet. That's what it's there for. So aside from that, though, I often have reminded kids, especially at the teenage level, that unless you tell somebody, no one's going to know. So if you go tell the adult in a safe space, they're protecting your rights by not sharing who that source is. And they are supposed to respect that. And I mean, that goes with most reporting. And as often as possible, if they have to break that, they will let you know. But just keeping in mind to our kids that it's okay to report and it's okay to say something because you could save a life. You could save multiple lives. Yeah. Like that kind of stuff.
Well, what do you love about what you do? Can you pinpoint one thing? Or I can definitely tell that you're very passionate about it. Yes. What do you get out of this?
Well, I am a huge supporter of appropriate crisis response. I think that having personally experienced like growing up in school, because I mean, I was in high school when Columbine occurred and just knowing that how scary of a time that was. And now I look back and go, wow, look at where I am now. I support so that doesn't happen. Yeah. And I think that's important. Keeping kids safe is just so crucial for so many things. I what's the word?
It'll come to you.
It will come to me eventually.
Right. Well, yeah.
I think it's cheesy to say that like our kids are the future. Like I know that that's the common phrase, but I truly believe that as somebody who was a kid once and now helps support. And so I look at it in that perspective of like each kid has a pathway for their life, and we want to help them grow and learn and identify what is the best way to support, because that path is going to look different for everybody. And I also have to acknowledge that, like, in a traumatic situation, that has the potential to really change a lot of what we do moving forward. Mm-hmm. And if we're still giving the best possible outcomes amidst the terrible situations that on some level might be out of our control, that we're still providing that best opportunity. And to me, that's that key piece.
Just in day-to-day, advice for parents and families, not necessarily having to deal with a traumatic event, but just the day-to-day of raising a kid and dealing with the ins and outs of school and growing and puberty. What is kind of your best practices for parents and families when they're kind of feeling a little bit overwhelmed? Are there resources for them to just come and talk with the school counselors or the psychologist and say, hey, here's kind of what I'm feeling, or, what do you think about that?
So at this time, I have to acknowledge the capacity for our counselors and our mm-hmm. school psychologists. And I know that every counselor and psych that I have met with are always willing to have conversations with parents, because mm-hmm. the more collaboration that we have between the home and school, and the more on par we are with one another and understanding. And I'm not saying like families have to do it the way ASD says, mm-hmm. kind of thing. I'm saying in the sense of like, the family home communicates to the school what it's like, and the school communicates to the family like what mm-hmm. they're dealing with and how they're supporting that student and their child. Then we're creating connections and we're building those relationships so that we have consistency across all of the environments our kids are in. And I think that that's one key piece is that willingness and openness to communicate with one another and having that trust and, mm-hmm. and trusting relationship. And I think that requires empathy, which is what I tell a lot of our teams, is just being empathetic and being communicative with our families, so that not only do we understand where they're coming from, but they understand what we're working with and where we are in supporting them. And then at the home level, I think one of the key pieces is having routines established. Mm-hmm. And a little plug for parents, always take care of yourself. Give yourself some minutes, some
Why
time.
Is that so hard for us?
It really is. I think that as an adult, it's just so easy for us to just pass it off. And really, if we have like a regular daily routine for mm-hmm. ourselves, then we're engaging in the best self-care possible of just being able to say, okay, this is what I'm doing for myself mm-hmm. every day, because you matter too. Yeah.
So, I always say self-care is not selfish.
No.
We'll rewind that back and play that again.
It's also okay to be selfish sometimes.
Yeah, you're absolutely right.
You totally need that.
That's too. Yeah. We live in Alaska. Yeah, we live in Alaska. We're getting into these colder months. It's already darker earlier. Yes. I know it's a big thing for, the seasonal affective disorders and the depression and just kind of feeling down and kind of the blues. What is your advice, to families and to students about just getting into some daylight and getting out and, going into these winter months, which they're long and they're hard.
Yeah.
Even as an adult.
Definitely one, I always have to put the plug in of making sure you're medically, physically still mm-hmm. healthy, and that if you're not, that you're seeking support there. So mm-hmm. I know like my own doctor will push vitamin D kind of thing. So those pieces, that physical level of health is just as important and valuable. And it goes on par with our mental health, mm-hmm. right? But also making sure that we have opportunities for sunlight or like a happy light of some sort, but that we're getting outside or that we're moving, even if it's not necessarily that we have, because I don't know about you, but when it's down to the 5 hours or less, I am not outside during those times. I'm definitely in the office or running to another school or mm-hmm. something. And so that likelihood goes down. Yeah. But at least getting movement, like that is just so key. Yes, because you want to increase your serotonin and dopamine levels, and we do that through physical movement. We do that through exercise. We do that through laughter. Mm-hmm. We do that through socialization. So on some piece, if we can hit all or one of those boxes, then we're on that pathway to making sure that we can decrease the chances of having a seasonal affective disorder mm-hmm. or some kind of depressive episode. So.
And you deal with the Anchorage School District, the largest school district in the state. Just curious, just in general, how have you seen our students, kind of more in particular teens, address mental health? Is it something that you're like, oh, wow, this is awesome. They're more mature than I thought? Or, what is your take from the student level? Because you kind of I feel like have an in.
So I have to highlight that I'm not speaking for students. Mm-hmm. So this is a broad range. Yeah. I have seen every range of the struggle. Mm-hmm. And some of our kids do it really, really well, and they can get through that. And then others of our kiddos might struggle a lot more and have greater difficulty. So it's just such a spectrum of potential. So,
and you're there to help them.
Yes, and I would say too, sometimes it ranges day to day. And I've told kids that's okay. Mm-hmm. We're not going to be our best every day, and we're still human, so we should be allowed to not be our best every day.
And adults too.
Adults too, absolutely.
I always love to give my guests kind of their final thoughts and final words. I think it's such an interesting topic, and I know it's going to lend a lot of help for those that are listening. So is there anything that you would like to mention or add or just share, or just in general, or any words of advice, final thoughts regarding this topic?
I think just remember to be kind to yourself in all circumstances, especially the hard ones. Mm-hmm. Sometimes we tend to be a little bit too critical of who we are or how we've responded. And if we give more grace and forgiveness to ourselves and empathy to ourselves, we're more likely to share that empathy and kindness with others. And that spreads. And the more that spreads, the more that we feel it amongst one another, and just the overall better of a community that we have. And I think that's key.
And lastly, how can folks, if you want to give a site or reiterate once again, if people want to contact their schools or you, what's the best way to go about that?
So if you're within the Anchorage School District, you can go to your school's website specifically, and it should identify who your school counselor is. If it's not on there, you're always welcome to call directly to the main office and ask them if you can get that contact information. But ASD's Mental Health and Student Supports does have a website, and under the Critical Response and Wellness tab, it has all the different links of how crisis response works, what behavioral threat assessments and guidelines there are, what our suicide risk assessment guidelines are, as well as our link to stop it in case you do want to make an anonymous report for anything.
Well, thank you so much for taking the time and chatting with us. I really enjoyed speaking with you. So thank you for coming on and sharing. We appreciate it.
Yeah, thank you for having me.
And thank you all for listening to another episode of Parenting in the Far North. Remember, don't forget to like and subscribe.